Hi, Jonathan.
Hello.
Thank you for taking the time to do this interview.
Mm-hmm.
So, what was your expectation before arriving?
To be honest, I didn't really know what to expect. I'd seen the website and it looked amazing, but partly it looked almost too good to be true. And so me and Sonia would make jokes about how we'd get there and it would just be like a motel room or something like that. So I didn't really have a lot of expectations, but this place absolutely surpassed all of them. So it's been great.
Now that you've been here for a few weeks, how have your expectations changed re the clinic, hospital, and the area around Temba?
For the clinic and the hospital, I'd say I was expecting to be doing more direct patient care, and we definitely did quite a bit of that, but we found that our role was primarily actually doing teaching for the clinical associate students, for the nursing students as well. And in reflecting on that, I feel like that was actually a much more sustainable thing for us to be doing, because it allowed us to kind of impart some of our training on the people who will be providing care here in the area, and it seems to allow the doctors who work here as well more time to see patients on their own rather than spending all their time teaching and seeing patients. So it seemed like a really good model, and I ended up enjoying it a lot. So not to say I didn't enjoy the patient care aspect as well, but I really appreciated the chance to get more involved in teaching.
What experiences surprised you, made you smile, or tugged at your heartstrings, being in the volunteering section or during your leisurely time?
I'd say the two that come to mind. One was when we were in the hospital itself, and suddenly all the nurses and staff there just started singing. And it was just such a beautiful moment, and it really reminded me of just how, where I practice in California, like that would never happen. But music can be such a form of healing in and of itself. And so me and my colleague Sonia just stood there and listened for like 5 or 10 minutes, and it was just such a beautiful moment. So that definitely stood out for me. Another moment that stood out was we were teaching some of the nursing students what to do if a patient tries to attack you, if they're very hostile or agitated. We had all of them stand up and go through it together. And that was just such a fun, and it seems strange to say that was a fun and joyful moment because we were teaching people how to react when someone's trying to attack them, but it was great just to see them actually learning those kind of skills and having fun with it. And so that was a moment that definitely brought a smile to my face.
Besides spending time at the hospital, what else did you do for your leisurely time?
The first 2 weekends we went into the Kruger twice, and just did a game drive, drove around, and that was amazing. Before going, like, I knew it would be a good time, but in my mind I was thinking, oh, it'll be 10 hours in the car, I'll just be sitting there, it won't be very fun. But it was just an amazing experience. We saw so many animals. The second time we saw a group of lions and got the best position of all the cars just to see them right outside of our window. So that was just an amazing experience. And then this past weekend we had the opportunity to go down to Joburg for a few days, and that was amazing as well.
Now that you're departing, what lessons have you learned from your experience at Temba?
Main lessons I learned, surprisingly actually, were how similar things were between my practice in the United States and how things are done here. I had expected to come in and be wowed and surprised at all moments by the differences in how patients presented or how care is delivered. And there are definitely some moments like that, but overall I was more struck by the similarities, not only in terms of healthcare delivery and disparities between different economic groups, but also in terms of how the patients presented and the complaints that they had. So yeah, I expected to come in and look for all the differences, but I think I was impressed by all the similarities, and it really kind of reaffirmed the idea that the lessons that I'm learning here I can take back with me to my practice in the future, and that can really inform how I see patients moving forward.
What would you like other volunteers to know about your overall experience here at Temba, at the property, and at the clinics?
Um, I would say if you have a chance to do this, come do it. It's been an amazing experience so far. Working at the hospital is very dynamic and interesting at all times, and then you get to come back here to Chemba and enjoy the pool, enjoy the air conditioning in the room, have a wonderful, comfy bed, eat lovely food. Like it's just, it really is a great model, and I think it's something that hopefully will be replicated in other places. So if you get the chance to do it, I would say do it.